Hello and welcome to North Country Matters. My name is Donna Seymour. I'm a member of the St. Lawrence County League of Women Voters, one of the civic partners for this show. Today, we're going to be talking about Medicare. My guest is Sherry Christiansen, who is a certified Medicare Advantage Specialist insurance consultant. Today, we're going to take a look at the ins and outs of Medicare and what you need to know to make a good decision when you're looking at Medicare plans. Sherry, getting older is no place for sissies, and this is certainly true when it comes to looking at Medicare and supplemental plans, isn't it?
Oh, definitely. Definitely.
So the
Uh,
timing of our show is good because right now we're just at the beginning of the open enrollment phase of Medicare, which runs from October 15th to December 7th. You are a financial consultant by training and profession, but the reason that you actually got involved in being a Medicare specialist is very personal. Would you share your story with us?
oh, yeah. Uh, well, part of being a financial advisor and helping people prepare for retirement, the questions that I ask include things such as taxes and what long term goals are and so forth. But medical expenses have become huge. And this really hit home for me. And the reason why I expanded my practice to include doing the Medicare Advantage, Medicare supplements, and learning more about Medicare is because it hit home when my parents got older and my dad came down with cancer. And I saw what happened or what could happen if there wasn't proper Medicare planning, healthcare planning. I mean, my dad, uh, when he started going to hospitals for his treatments and his doctor's appointments and so on and so forth, if it weren't for the fact that they had a good, solid backup plan for the medical health coverage that my dad had needed above and beyond original Medicare, it would have wiped out what they had worked so hard together for the 58 years they were together. It would have totally destroyed the savings that they had. And because we did prior planning, we asked the questions, we had them aligned correctly. You know, my dad passed in 2017, but my mom was still able to continue in the house that they built, the home that they built, and it did not devastate her savings, so she was able to continue on. And that to me is probably the most important thing why people need to really pay attention to their Medicare and their Medicare plans and coverage.
Well, thank you, Sherry. In fact, my parents said very much the same story. My mom got cancer later in life, and every time she went for a treatment, it was $24,000. And because they had a very, very good Medicaid supplement plan, she paid out of pocket 200. So again, exactly the same story. It would have devastated them financially, and they would have had no resources at all left to finish out the rest of their life with. So I appreciate that story. So talk to us a little bit, Sherry, about the training that you have to undergo in order to become a specialist, because there's a lot to it, isn't there?
Oh, yes. Basically, when people are enjoying their August by kicking back and doing the last days of summer, I'm usually got my head in the books and doing my recertifications. And yeah, it is pretty extensive. One of the first things that I have to do is I go through what's known as the American Health Insurance Plan training, which is also known as AHIP. This is it's an American political advocacy that works with Medicare, and it goes through all the changes in Medicare, and what the plans have to adhere to. And once I go through their training, then I have to go to every provider that I go through and represent. In this particular case, because I'm an independent, I currently represent 7 different plans or 7 different providers, and each of those providers have their own training that I have to certify. So every year it's something different, something new, changes coming. There's different things that are covered, weren't covered one year, are now covered this year. Especially drug plans, I find the formularies every year they change. So there's a lot to learn and a lot to know before I can even say word one on when talking to someone about Medicare and their health coverage plans.
Yes, and as you'd mentioned with your parents, although you're not of Medicare age yourself, you were taking care of and advising people who were, and so that's true for many of us with elderly parents that we are find ourselves in that position. And so, if you're a caregiver, it's important to understand how Medicare works. So let's go over the basics. What is Medicare? Who's eligible, and how is it paid for?
Okay, that's always a fun question. All right, so Medicare. Medicare is the national health insurance program in the United States. It was established back in 1966. It originally started under the Social Security Administration, and then now it's under the Center for Medicare and Medicaid Services. So it has its own entity. It provides health coverage for people who are 65 or older, or if it's someone who has a disability or an illness that where they can no longer work for 24 months or more, then they can become eligible for Medicare. This is not to be confused with Medicaid. Medicaid is done by the state. So two different things. Now, as far as you wanted to know
How it's paid for, Sherry?
how it's paid for. Thank
right.
you. Now, this is where there's a couple of different parts to Medicare. So what people are most familiar with is there's Medicare Part A. Medicare Part A covers the hospitals. It covers hospitals. It covers your anytime you go in for what they call, I'm sorry, I got to get the right words here. So if you have like a skilled nursing unit, yeah, so there's somebody who's gone into the hospital, had a procedure done. They really can't go home yet for whatever, so they can go into a skilled nursing unit, which is kind of that in between. And it does cover hospice care. All right. That usually is a zero premium. There's no additional premium paid. There are exceptions, just like everything else. There are exceptions, but usually that is the reason that is covered from a person paying into the system, into the healthcare system for about 10 years or more. Medicare Part B is the one that people have the most concern with because that's the one that is your actual medical care. That's the one that covers your doctors, covers your physical therapists, people along those lines. And that's the one that does have a tendency to go up every year. Right now, it's $144.60 on average. Next year, it's going to go up about another 8%. But that's the one that I said people sometimes get confused and think, oh, it's free. It's not. That's the one you pay for. Now, the other part that is fairly new that was actually established in January 1st of 2006 was the Medicare Part D. Now, the Medicare Part D is your prescription drugs. That is not covered as under the government entity. That is something those plans are developed and provided by independent insurers that are out there. They do the standalone, what do we call standalone prescription drug plans. So you have to pay for that too. But again, that is varied, depends on who you go through, how extensive you want your drug coverage and so forth. So that's done on an individual basis.
Okay, thanks. And you're right, it is complicated, and it's good to have a short summary of that. So there are gaps in coverage, as you explained. Drugs are one of them. And you need a plan to fill in these gaps as a critical part of your financial planning that seniors need to do as they get ready to retire. So basically, there's two types of Medicare supplement plans. Why don't you go over the differences between those for us, please, Sherry?
Okay. Now, a Medicare supplement plan, if you want to equate that to like when you are employed and you have a plan through your employer, that is something that covers your, what people refer to as a regular health care plan. Well, what a Medicare supplement plan or Medigap plan does is Medicare Part A and B generally only cover about 80% of the cost of your care. So now you as a consumer or a patient, if you have, say you go into the hospital and you have a procedure done, it is not unusual to have like a $500,000 bill, medical bill. The government says, great, no problem. We'll cover $400,000 of that. You have to pay the other $100,000. And I don't know of too many people that can just open their checkbook and say, here you go. So what the Medigap or the Medicare supplement plan does is it helps cover those costs, those co-insurance, the co-pays, the deductibles that aren't covered, that would be in that 20%. And the Medicap plans, they're pretty uniform. There is, I believe there's 6 different variations of it, and they have different premiums that, and they can pay they cover as much or as little, but they don't cover any more than what Medicare already covers. So there's no dental, there's no vision, no hearing or anything like that. It's only what Medicare covers. Now, some of the plans do have a foreign travel in there that you can pay for. So somebody who does go on cruises, or say they go to Canada or Mexico or something like that, if they have that supplement plan and they do need medical care when they are out of the country, they do have that protection.
So you're saying that if you only have Medicare, you have no coverage if you are outside of the physical United States. Is that correct?
Correct.
Okay, thanks.
Yeah. Now, the counterpart to that is a Medicare Advantage plan. So a Medicare Advantage plan covers everything that Medicare Part A and B does, but that will have, in some cases, there is a copay. You might go to the doctors, you may pay $5. You may go to a specialist, you may pay $35. But each Medicare Advantage plan, it's very important to see the plan, to read it. You want to make sure that, unlike a Medicare supplement plan where you can pretty much go to any doctor or any facility that accepts Medicare, a Medicare Advantage plan is a little more in depth in that they have both in-network and out-network, very similar to someone who may have had an employer plan and they're familiar with a PPO or an HMO. And a PPO stands for Preferred Provider Organization, or an HMO, which is a health maintenance organization. But either way, they can go, they see their doctor, they see their specialist and so forth. And what's nice about the Medicare Advantage plan is it does offer additional coverage or additional options that do cover things like dental, vision, hearing, travel. And they can also include in their plan options for people who do like non-traditional medicine, such as they look at chiropractors. They may go to a chiropractor or an acupuncturist where that's not covered by Medicare at all. So there's each plan, like I said, looking at the different plans, they have different options, but they all do cover Medicare Part A, Medicare Part B. And then the other part that's most important with a Medicare Advantage plan is there is no need to buy an additional drug coverage plan because it's included, whereas with a Medicare supplement plan, no drugs are included. You still have to buy that standalone Part D plan.
Okay, great. Thank you. And again, complicated stuff, and you're helping us to understand this. So let's talk now about accessing Medicare. How do you get signed up for Medicare? What are the options for folks? Obviously, when they turn 65, that's one, but there's a couple of other options, isn't there? At least to look at, looking at what additional plans you might want.
Okay. So if I understand, as far as when you have to enroll,
right.
Okay.
Let's start with
so
that.
Yes, the most important that everybody knows is I'm turning 65. I get on average at least 10 calls a week of I'm turning 65. What do I got to do? So when you're turning 65, it's known as your initial enrollment period. So the initial enrollment period begins 3 months before you turn 65. the month you turn 65, and 3 months after you turn 65. During that time period, you get your Medicare Part A, your Medicare Part B, and then you at that time, you can enroll in a Medicare Advantage plan, a Medicare Supplement plan with a Part D plan, just depending on what your needs are. Now, one of the things that I want to clarify is the Medicare Part B is contingent upon the individual if that person is going to have continued health coverage through their employer. If that's the case, then oftentimes they can defer enrolling in their Part B if they're with if they have what they call credible coverage. Once they fully retire, even if say they work till they're 68, once they separate from service or they fully retire from that employer, and the employer says, it's been great, thank you, and by the way, you're retiring December 1st, well, your medical coverage will end December 31st, that person has to now go back, get their Part B, and then once they get their Part B, they can get into a Medicare Advantage or Medicare Supplement plan if they choose.
And that is their responsibility as a retiring employee to recontact Medicare and tell them their status has changed, correct?
Yep.
So it won't happen automatically.
Yeah. Yeah, they won't send you a nice letter and say, hey, you're retiring, you really need to fill out these forms to get your Medicare Part B. The onus is completely on the individual. Okay. The only time that they will ever, the Center for Medicare and Medicaid Services will ever send out those flyers or those letters, or you'll get them from Social Security, is when you turn 65, and that's it. So that is what they consider like the qualifying events, is turning 65, and then if you delay your turning, your Part B. Now, the other part, and I touched on that earlier, is if someone is under the age of 65 and they have that injury or that illness where they can no longer work, there are certain diseases, there are certain medical conditions that will qualify the individual for Medicare. But again, the wait time is normally 24 months. There are exceptions to that. It's usually if somebody has kidney failure, they have renal failure, there is no waiting. So it's just they're in there, and there are some conditions, I believe, like heart conditions and so forth, where it will speed that process. They won't have to wait the 24 months. But again, there's a whole laundry list that they go by, and again, when a person is in that situation, usually they'll let them know, yes, you can enroll in Part B, and there's no problem there.
Okay, and then we come to the part of the year that we're in right now, which is the annual enrollment between October 15th and December 7th. So what does that allow folks to do?
Okay. Yeah, annual enrollment, it kind of reminds me of Christmas, because people get inundated with all these cards from people they only hear from once a year.
I know, I've been getting that mail myself, so I understand that. Yes.
Yeah, I go to my clients and they'll have stacks, and it's like, do I need this? No. Do I need it? No. So anyway, what annual enrollment allows an individual to do is, if they are enrolled in a Medicare Advantage plan, at that point, they can enroll in another Medicare Advantage plan if they feel that the plan they're currently in no longer suits their needs. So they can make a change. And during annual enrollment, they can actually make more than one change, but whatever they're in come December 7th, that's where they are. This also allows people who are just in original Medicare, in other words, all they have is Medicare Part A and Part B, and they might have a drug plan, to say, you know what, I want to enroll in a Medicare Advantage plan. They want to take advantage of the cost caps that a Medicare Advantage plan affords them. So that allows them to newly enroll into a Medicare Advantage plan. Quite the opposite too is if somebody doesn't want to be in a Medicare Advantage plan anymore, they can drop that. They can go back to original Medicare and just get a Part D drug plan, and they don't have to worry about any kind of penalty. Also, somebody who is in a Medicare Supplement plan and they want to change their drug coverage, they can do that during this period too. So there's a lot of different things that people can do from October 15th to December 7th.
And some of the
So,
reasons for that are actually if your health has changed, if you've
oh,
had
definitely.
something major happen to you and you realize that the plan you had was fine when you were healthy. But let's face it, as we get older, we tend to develop more medical problems. So being able to review this on an annual basis is actually a very good thing, especially for financial planning, isn't it?
Oh, it's huge. Yes. The scariest thing is if somebody doesn't sit with someone like myself and review their plan, and then they don't realize that, say maybe their doctor has retired and moved, and now the one they're going to isn't in network anymore, or they now have a new drug that they have to take, and that drug out of pocket could cost them $300, $400, $500, only to find out, oh, their plan doesn't cover that. So little things like that can add up to a lot. And taking the time to review their plans, review their summary of benefits, that's, you want to do that. If anything, sit down, get a cup of coffee, put it in front of you, call your advisor, say, I want to go over this because I want to know, I don't want to have surprises come December 1st.
Right. And
Uh,
you know, the interesting thing about that is that although we who are on Medicare and have a plan do get our little annual summaries, it takes a PhD in insurance to go through those and really understand a lot of the details, doesn't it? It's just not stuff that people are usually, they have enough background information to make good choices by themselves. So where can people go to get help they need to understand the plans and their choices, Sherry? How can just the average person get the help they need?
okay. Well, you have people like myself. I said, this is my profession. This is what I do. And I do it with a great passion because of the importance of healthcare coverage and how it can affect you in your retirement years. So I said, I'm a huge advocate, and I will sit down with people. I will go over what they currently have. And I have no problem telling somebody, nope, you're in a good place. Or wait a minute, you've had a change. Are you aware of this? So people like myself, that's what I do. Another way to do it is they can go to medicare.gov. If they're computer savvy and they want to sit down and pull up the computer, there's just a plethora of information about Medicare, what it is, what it isn't, what it does, what it doesn't. And it talks everything about premiums and who it applies to, and when to apply, and where to apply, and so forth. As far as looking at the individual plans, Medicare, again, medicare.gov, you can put in your zip code, and it'll ask you a laundry list, a short laundry list of information to try to get the individual narrowed in on what they're looking for plan wise, and it'll bring up the providers that do that and the plans that cover their area. There are also some offices like the Office of the Aging can be very helpful. Uh, the with the Office of the Aging, bless their heart, they're just like with the other government entities. It's really, really hard to get in to talk to anybody. And sometimes they are very limited on the plans that are out there. They have limited knowledge. They know some, but they don't know all. So for them to make you know, to be able to make a decision for the individual, you got to have some, be aware. The biggest thing is when you go to talk to somebody like that, or like myself, the first thing I'm going to ask you is, who are your doctors? What are your medicines? What hospital, if you had to go to a hospital, what hospital would you go to? Because I would want to make sure that anything we look at covers those crucial points.
You know, so
So
another point I want some clarification on, Sherry, is you are a Medicare Advantage specialist consultant, but those folks don't actually get paid for that work, do they?
no,
In the sense of you're not going to collect a fee from somebody by sitting down and doing this with them because of the type of insurance specialist you are. This is basically, you've informed yourself, but this is not something you charge people for, correct?
correct. Yep, I do not charge for this service. So no one, I don't want anybody to hesitate in contacting me because I think, oh, I'm going to have to pay a consultant fee. No, no, I don't do that. And I do want to clarify, it's not just Medicare Advantage plans. It is all, it's Medicare Advantage and supplement plans.
Okay.
Because a lot of the Medicare Advantage providers also do the supplements. So
Mhm.
it's kind of a one-stop shopping. But no, my services, I would, I don't want anybody to hesitate to call me because this is what I do, and I will treat people like I do with my own parents. This is how important this is to me and to the people that I serve.
Well, thank you for that. So, I want to talk for a few minutes with you, Sherry, about our veterans, because it turns out that even though veterans have medical care that's guaranteed through um, the federal government, and many of them are of Medicare age, there's still reasons for them to think about having these supplement plans, isn't there?
Oh yeah. And this is something I'm very excited about because the providers of these plans have really gone above and beyond for the veterans. One of the things is veterans. I right now I'm here in Rome, and we have a VA clinic not too far from my office, which is great. But if any of those veterans should happen to have a heart attack, they have to go all the way, or they have to go all the way to Syracuse, Albany, Bath, something along the for care. So I don't know, but if somebody has a heart attack, I'm pretty sure they want to get to the closest facility that's going to take care of them right then and there. So what with these plans that are geared toward veterans, it addresses those exact things. I will tell you, I'll share a story with you and your listeners, that I do have a client that at first he was like, nah, I don't need anything else. So I said, well, I explained to him about the veteran plan and how it's geared toward him. I know he gets his medicines through the VA. I know he gets his glasses through the VA and so on and so forth. But what this does is it complements what he has. And if there's a situation where he can't get to the hospital right away, he's going to be able to go, or he can go to a private physician for care. Well, long story short, he was out four-wheeling and he had an accident and he broke his leg in two places. And it was a pretty bad break. So they weren't going to take him to Syracuse, but they took him to the local hospital and he ended up having to pay out of pocket. This is before he had the Medicare Advantage plan. He had to pay out of pocket $10,000 for this broken leg, where if he had the plan in place, his cost would have been $600. So huge difference. And again, many of these veteran plans, there's no premium or there's a very low premium. So it really does complement their care.
And that's actually true of a lot of the plans, is that you have the plan and you may not have an out-of-pocket cost, or it may be a very modest out-of-pocket cost, and yet it picks up all these additional uh, expenses that Medicare doesn't take care of. Isn't that true?
Yep. Just like the earlier example, if someone with just original Medicare, they could be looking at a bill for $100,000, where these other plans, or whether it be a Medigap plan or it be a Medicare Advantage plan, their out-of-pocket cost is just reduced significantly to maybe, like you said, they may only pay $2,000 or $6,000 total out of $100,000 bill.
Right, which is
So it's
much more manageable. The financial burden of getting sick is bad enough for anybody. And in fact, one of the things I've done a lot of reading about this, and it talks about the lifetime medical costs for retirees who have not done adequate planning can be astronomical.
Yep. Figure about $250,000. That's
And
an
most of us
average.
don't have that in our back pocket. I don't care who we
No,
are. So,
no,
so there's some
I don't
other
have it in my desk. I don't have it in my change drawer. I don't have it.
So, Sherry, there's some other reasons also for some of the advantages to these plans. These plans often act as the Medicare portal, don't they? Explain what that means.
All right. It's as far as the if I understand your question, as far as a Medicare portal, it allows, it's kind of like, they have one phone call to make, and those people that they contact will do all the heavy lifting for them. So if for example, if somebody is diagnosed with a well, we'll use cancer because a lot of people, that's a big fear. They can look at their card. They have a number that is dedicated to them. They can call them up and say, hey, I've got this going on. I don't know what to do. I need help. That case manager on the other end will pick up the ball. They'll help coordinate the care. They will help answer questions about the care, medicines. They can coordinate doctor's appointments, therapist appointments. It really takes that burden off that individual who is already overwhelmed with the fact that, oh my gosh, I have something happening to me that I never thought would happen. Also, the providers are very good about having active websites where somebody can go in and do some research, as to what they're having to face. So it's another way, it's another tool to keep that individual informed about what's going on and things they need to consider when they're using their plan and addressing these health issues.
Yeah, and we've also found with the plan that we have that we get periodic phone calls from the company wanting to know what our health is, trying to make sure that we're taking care of ourselves and the preventative side of things, because they are working with us as a partner to keep us healthy, because in the long run, everybody saves. So,
Yes.
and one more thing, Sherry, because this is something that you and I talked about when we were talking about our plans, is you had mentioned to us that because we have family who live in other parts of the country, we do a fair amount of traveling within the country, but not all plans cover procedures or doctors in other states. So explain a little bit about that and what people should be thinking about, especially if they do a lot of travel.
Yep. I affectionately refer to a lot of my clients as snowbirds. So when we do look at plans and they do go to Florida or they go to North Carolina or South Carolina or Hawaii or whatever, the first thing I ask them is, how long are you going to stay? Do you have a provider out there already? And many of them do. If they go over and they're staying there 3-4 months, they already have a go-to in case, like especially if they have a condition where it's chronic and they have to check in every so many months. So when I look at these plans, I make sure that that plan does cover them in the state that they're going to. Plus, I can look to see if the provider that they use if that individual or that hospital, that clinic, whatever, is in network. So they already know if they go there, that's if they're going to pay $5 for their doctor up here, they're going to pay $5 for their doctor down there because it is in network. But again, even if that person is out of network, a lot of these plans, there's still coverage there. Just know that instead of paying $5, you may have to pay $10. So just be aware, but I do make it a point to make sure that plan is going to be as close to a perfect fit as possible for them. So and that's with any type of coverage. They need to know before you go.
Right, there's a lot to consider in all of this. So as we wrap up, Sherry, what are your closing thoughts on this? Your final bits of advice to people to be thinking about as they either get ready to hit Medicare age, or if they already have, what should they be doing with this time frame that they have between now and the 7th of December?
Okay. All right. The biggest thing is, number one, if you have a plan in place, get your summary of benefits, look it over. See what changes are going on. If you've had a doctor change, like your doctor has retired and you've got a new one, or you're gonna now you've entered into retirement and you're gonna start traveling, make sure that whatever you have will still fit your current need. And also the flexibility. If you feel that like dental care is like number one on your list, make sure that that plan, if it has a dental plan, how does that dental plan work? Some Medicare Advantage plans, you have to pay an additional premium to get dental care, what they call comprehensive dental care. Some of them don't. They work on a system where they say, okay, you have this bucket of money to use for dental. We don't care if it's a tooth pulled or a filling or just a cleaning and x-rays. That money is for you to use for dental. Same thing with eyeglasses, same thing with your hearing aids. So you want to be aware of that. Also see if there's any changes in premium, because some plans, they have upped their premium. So be aware of that. Medicare supplement plans are especially those that pretty much have an annual uptick every year. But again, know what you have, know what the costs are. You don't want to be surprised come January 1st when you look at your Social Security check and go, wait a minute, I'm $50 less. How did that happen? That way, if you're new to Medicare or you're going to be enrolling in Medicare because you're turning 65, by all means, start making the phone calls now. Give me a call. I can help you through the steps. If you're someone who is falling into that category where you had employer coverage, but now you're beyond 65, but you're going to be retiring this year, there are 2 simple forms that need to be filled out in order to get your Medicare Part B in place, so that when you come and you retire the following month, there is no lapse in coverage. So pretty straightforward, but sometimes this does fall through the cracks, and people will, again, as you pointed out earlier, they expect a phone call. If they don't get one, that the responsibility is entirely on them. So it's a good time. And also when you're looking at your medical bills, if you have a treatment that you went into, don't be afraid to ask your doctor, what are you doing and why? And then when you look at your summaries every month, because people that have these plans do get summaries every single month, tells them what they've done, where they are with both drugs and care. If you are looking at a hospital bill and something just is like, I don't remember having this done, pick up the phone and make a call. Because this is done by entry. Sometimes people make mistakes. They do the coding wrong and they'll code for one thing and it's actually something else. Don't be afraid to ask. So take control of your medical care by asking those questions.
So being your own advocate is always, as always, the best policy, isn't it? So.
Oh yeah.
Well, Sherry, I really appreciate your time today. I know these are complicated issues. People have a lot of questions. I hope we've been able to answer some of those questions for folks and demystify some of this process for them, because your health is it's precious, and you don't want to take any chances with it, and you certainly don't want to go bankrupt because you haven't made a good choice or you haven't reviewed these plans. We're lucky we have this opportunity every fall to do this review, and this is a great reminder for folks to pull out your policies, pull out your booklet that tells you what the plan changes are for next year, and make sure you understand what's going to happen next.
Definitely.
So thank you very much again for coming in. So these conversations are a production of North Country Matters. This show is a civic collaboration between the St. Lawrence County League of Women Voters and the Potsdam Public Library. Until next time, remember, our North Country matters.